Have you ever talked to someone and noticed a foul odor coming from their breath? It's a situation that can catch you off guard and leave you feeling uneasy. It can be an awkward and uncomfortable situation both for you and the other person. The conversation might start to feel strained, and you may find yourself wanting to cut it short. Bad breath, also known as halitosis, is a common problem that can significantly impact our confidence and social interactions. It's not just a minor inconvenience, it can lead to feelings of embarrassment and social isolation. Imagine this. You're about to go for a job interview or a first date. These are moments where making a good impression is crucial. You're feeling good about yourself until you realize your breath could knock someone over. Suddenly, all your confidence evaporates. Suddenly, your confidence plummets, and you're preoccupied with worrying about your breath instead of focusing on the important interaction. This anxiety can be distracting and make it hard to be present in the moment. Bad breath can make us self-conscious and hesitant to engage in conversations. We might avoid social gatherings or keep our distance from others, fearing judgment. It can affect our personal relationships, our professional lives, and even our self-esteem. The impact of bad breath extends beyond just the physical. It can take a toll on our mental and emotional well-being. The good news is that bad breath is usually treatable, and in most cases, simple changes to our oral hygiene routine can make a world of difference. Regular brushing, flossing, and using a tongue scraper can help keep bad breath at bay. Additionally, visiting your dentist regularly for checkups can help identify any underlying issues that might be causing bad breath. With the right care and attention, you can regain your confidence and enjoy social interactions without worry. Before we dive into the solutions, let's understand what causes that unpleasant odor in the first place. Bad breath, also known as halitosis, can be an embarrassing problem and can affect anyone at any age. It's important to know that bad breath is often a symptom of an underlying issue, rather than a problem in itself. The primary culprit is often poor oral hygiene. When we neglect our oral care routine, it creates an environment where bacteria can thrive. This bacteria feeds on food particles left in our mouth, leading to the production of foul-smelling compounds. When we don't brush and floss regularly, food particles get trapped between our teeth and on our tongue. These particles are a feast for bacteria, which then produce waste products that smell unpleasant. Brushing your tongue is just as important as brushing your teeth because the tongue can harbor a significant amount of bacteria. These particles start to decompose, producing smelly sulfur compounds. Sulfur compounds are notorious for their foul odor, often compared to the smell of rotten eggs. This is why maintaining a clean mouth is crucial for fresh breath. Certain foods like garlic, onions, and coffee can also contribute to bad breath. These foods contain strong-smelling oils that can linger in the mouth and be absorbed into the bloodstream. These foods contain volatile compounds that are absorbed into the bloodstream and released through our breath. When these compounds are exhaled, they can cause a noticeable odor that is difficult to mask with mints or mouthwash. Dry mouth is another common cause of bad breath. Saliva is essential for keeping our mouth clean by washing away food particles and bacteria. When our mouth is dry, it becomes a breeding ground for bacteria. Saliva plays a crucial role in washing away food particles and neutralizing acids in our mouth. Without adequate saliva, our mouth can't effectively cleanse itself, leading to an increase in bacteria and bad breath. When saliva production is reduced, our mouth becomes a breeding ground for bacteria, leading to bad breath. This is why staying hydrated and stimulating saliva production is important for maintaining fresh breath. In some cases, bad breath can be a sign of an underlying medical condition, such as gum disease, diabetes, or respiratory infections. These conditions can create an environment in the mouth that promotes bacterial growth and bad breath. If you're concerned about persistent bad breath, it's essential to consult with your doctor or dentist to rule out any underlying health issues. They can help identify the root cause and recommend appropriate treatments to ensure your breath stays fresh and your mouth stays healthy. The foundation of fresh breath is a solid oral hygiene routine. Brushing our teeth twice a day with fluoride toothpaste is non-negotiable. But it's not just about brushing, it's about brushing effectively. Use a soft bristled toothbrush and gently brush all the surfaces of your teeth for at least 2 minutes. Don't forget to brush your tongue as it harbors a significant amount of bacteria. Electric toothbrushes can be particularly effective in removing plaque and debris. They often come with built-in timers to ensure you're brushing for the recommended 2 minutes. Remember to replace your toothbrush every 3 months or sooner if the bristles become frayed. A worn-out toothbrush is less effective at cleaning your teeth and can even harbor bacteria. While brushing is essential, it can't reach all the nooks and crannies between our teeth. Brushing primarily cleans the surfaces of our teeth, but what about those tight spaces in between? These areas are often the breeding grounds for bacteria and plaque buildup. That's where flossing comes in. Flossing is a crucial step in maintaining oral hygiene that many people overlook. It helps to dislodge food particles and plaque that your toothbrush simply can't reach. Flossing daily helps remove food particles and plaque from between our teeth, preventing bad breath and gum disease. By incorporating flossing into your daily routine, you can significantly reduce the risk of developing cavities and gum-related issues. Use a piece of floss about 18 inches long and gently guide it between your teeth, forming a C shape around each tooth. This technique ensures that you are effectively cleaning the sides of each tooth without causing damage to your gums. Be sure to floss below the gum line as well. This area is often neglected but is crucial for preventing gum disease. Gently sliding the floss under the gum line helps remove hidden plaque and bacteria. Tongue scraping is another effective way to remove bacteria and freshen breath. Our tongues can harbor a significant amount of bacteria, which can lead to bad breath and other oral health issues. Our tongues have tiny grooves and crevices where bacteria can accumulate. These areas are often missed during regular brushing, making tongue scraping an essential part of a complete oral hygiene routine. A tongue scraper gently removes this buildup, leaving your mouth feeling cleaner and fresher. Regular use of a tongue scraper can also enhance your sense of taste and overall oral health. Finally, consider using an antimicrobial mouthwash to kill bacteria and neutralize odors. Mouthwash can reach areas that brushing and flossing might miss, providing an extra layer of protection against oral health issues. Look for a mouthwash that contains fluoride to help strengthen your teeth and prevent cavities. Fluoride is a mineral that helps rebuild weakened tooth enamel and can reverse early signs of tooth decay. By incorporating these 3 steps, flossing, tongue scraping, and using mouthwash, into your daily routine, you can achieve a healthier, fresher mouth. Section 5. Hydration, your mouth's best friend. Water is essential for overall health and it plays a vital role in maintaining fresh breath. Drinking plenty of water throughout the day helps stimulate saliva production, which naturally cleanses our mouth and neutralizes odors. Aim to drink at least 8 glasses of water per day. You can also incorporate other hydrating beverages into your diet, such as herbal tea or sugar-free drinks. Avoid sugary drinks, as they can contribute to tooth decay and bad breath. If you're experiencing dry mouth, you can try chewing sugar-free gum or sucking on sugar-free hard candy to stimulate saliva flow. Section 6. Quick fixes, on-the-go solutions for fresh breath. We all have those moments when we need a quick fix for bad breath. Whether it's after a garlicky meal or before an important meeting, there are several on-the-go solutions that can temporarily mask odors and freshen breath. Sugar-free gum and mints can help stimulate saliva production and mask bad breath. Look for products that contain xylitol, a natural sweetener that has been shown to reduce plaque buildup. Breath sprays can also provide a quick burst of freshness. However, it's important to note that breath sprays only mask odors temporarily, and don't address the underlying causes of bad breath. Natural remedies like parsley, cloves, and green tea can also help freshen breath. These remedies contain compounds that neutralize odors and have antibacterial properties. Section 7. When to see a doctor. Persistent bad breath and underlying conditions. While most cases of bad breath can be managed with good oral hygiene practices, persistent bad breath can sometimes be a sign of an underlying medical condition. If you're experiencing chronic bad breath that doesn't improve with home remedies, it's essential to consult with your doctor or dentist. They can help determine the underlying cause of your bad breath and recommend appropriate treatment options. Some medical conditions that can contribute to bad breath include gum disease, diabetes, respiratory infections, and certain gastrointestinal disorders. Treating these underlying conditions is crucial for both your oral health and your overall well-being. Section 8. The takeaway: fresh breath, fresh start. Bad breath is a common problem that can affect our confidence and social interactions. The good news is that it's usually treatable with simple changes to our oral hygiene routine and lifestyle habits. By brushing and flossing regularly, using a tongue scraper, staying hydrated, and consulting with our doctor or dentist for persistent bad breath, we can achieve fresh breath and regain our confidence. Remember, good oral hygiene is not just about fresh breath, it's about maintaining our overall health and well-being. Section 9. Call to action. Share the gift of fresh breath. Now that you're armed with the knowledge to combat bad breath, share the gift of fresh breath with your friends and family. Share this information with them and encourage them to prioritize their oral health. Together, we can create a world where everyone feels confident and comfortable sharing their smiles and stories without the worry of bad breath. Let's spread the word about the importance of good oral hygiene and the simple steps we can all take to achieve fresh, confident smiles.